Right, this is another old video and it explains sensitivity and what you can do about it. Unfortunately, there's no recent change, although all the toothpaste say they're better than the others. Just some seem to work better on different people. The toothpaste I recommend is Biomin, but you can't get it at the moment. But if you actually look up Biomin on YouTube channel, that has a more detailed explanation of how it works. It's a great British product. We should be promoting it more. Anyway, here's the video. This is a video to explain a bit about sensitivity that you may have to hot and cold. That's transient but extremely frustrating. The main reason is normally due to the gums maturing or receding, as people say, and the dentine being exposed, which is the kind of tissue that responds to these stimuli. Three main ones are erosion with acid, tooth wear from poor cleaning, and also stress. And what we're trying to do is to calm the tooth down. Generally, the dentine acquires a natural protective coating that fills in what we call the tubules, but certain things open them up, and they can be mainly carbonated drinks, your orange juice of a morning, your diet which has got a lot of acid and fruit, and poor toothbrushing technique. Erosion is where the protective coating over the dentine is dissolved and opens up the tubules, as you can see in the previous slide. So the more acidity you have, like the carbonated drinks or more fruit, the more likely you're going to remain in that zone. And similarly, if you suffer with gastric reflux or are sick occasionally, that can have a similar effect. So the other way is by overzealous toothbrushing, normally manually, and that can do the same thing of opening up the tubules. So the best advice for this is follow the instructions on cleaning your teeth in the app and get an electric brush. Generally, if you push too hard, they stall, and these have got better over the years. You don't have to spend a fortune to get a very good one. If you're stressed, often people grind their teeth overnight, and you can make yourself a temporary night guard. And the other thing is to embrace mindfulness. There are many forms of self-help relaxation, YouTube, thousands of books, and also lots of apps. Clearly, if you're after a quick fix, this isn't going to help, and you shouldn't really be taking analgesics, but there is a mountain of toothpaste, and just get one that may work for you. Personally, I find this has worked better for most of my patients, but it's quite expensive to just apply it exactly where the sensitivity is. And finally, with your diet, lots of people complain that teeth are sensitive when they have chocolate. Well, there's a clear option there. Sadly, it's the same with Prosecco and white wine. So if you do have it, you have to wait half an hour before you clean your teeth. Follow the mantra, clean your teeth twice a day for 2 minutes with an electric toothbrush. Spit out the toothpaste, don't rinse. If your teeth are a bit sensitive, you can clean them before breakfast rather than after. But always clean your teeth immediately before you go to bed. Spit out your desensitizing toothpaste and don't rinse.